father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to another episode of ATP webinar. I am Gbemisola Boyede. I'm a pediatrician, and today we'll be talking about autism. Yes, because it is the World Autism Day on the 2nd of April. Every year we celebrate the World Autism Day. And it's a time for us to create awareness about autism and autism related conditions. So that is why it is also appropriate that at this webinar today, we bring you more information about autism. Obviously, it is something we talk about every year. So most of us are quite familiar with autism. But today we're just going to refresh our memory about autism, and we can also talk about any new updates about autism. It seems like the autism condition seems to be increasing. There are lots of children with autism and adults as well, and many people are becoming more aware. So it seems we are getting a lot more diagnosis of autism, and so it's important that we are quite aware. And also, in the month of April is the World Autism Month. It is devoted to creating lots of awareness about autism. So welcome to the ATP webinar. I am Gbemisola Boyede. I'm a pediatrician. I'm a neurodevelopmental pediatrician. And so autism is actually one of the things we do as developmental pediatricians. We do the assessment and diagnosis of autism. So I'm very happy to be talking to us about this topic. If you have any questions, you can always ask your questions on Ask the Pediatricians Facebook group from Mondays to Saturdays. So I want to thank you so much for joining me today, whether you're watching from our Facebook group or page or YouTube channel, or you're listening to me on the podcast, or you're listening on Fresh Words Radio, or you're watching on Instagram Live. I want to say thank you so much for joining me for this webinar today as we talk about autism. All right, so I'm just going to show us a few slides about autism. So what is autism? Autism can be described as seeing the world from a different perspective, So if you look at this lovely picture, you can see about 4 ducks all looking yellow, facing one direction, and another just looking also yellow, but a little bit slightly different and looking in another direction. They are all ducks, they are all yellow, and so, but just a little bit of difference. And so when we talk about autism, we're talking about looking at the world from a different, slightly different perspective. People with autism spectrum disorder tends to have some differences from people who are not autistic. And so that is what autism is all about. If we want to define autism, there are different definitions that we can use. People with autism, we describe it as a lifelong disability. In other words, it is a condition that once you have, we don't take back that diagnosis. Most of you are quite familiar that most people without autism, most other conditions, sometimes we can treat them and then we'll say people are cured or people are healed, but autism is not that kind of a condition. It's not a condition that we can treat or that we can cure. It's just part of that person, it's part of who they are. And people who have autism are different. Sometimes we use the word neurodivergent or neurodiversity. They are a little slightly different from people tend to refer to as neurotypicals. Uh, so the way they interact with the world or the way they engage with the world is slightly different from people who do not have autism. So they have slight difference in terms of their um, communication, or what we call social communication, and sometimes interaction with the world. They tend to interact or communicate in slightly different way from people who do not have autism. Also, it's a neurobiological condition. It's basically has to do with the brain, but it's not like there's something physically wrong that we can see in the brain, but the way their brain is wired and the way they interpret and interact with the world is slightly different. So autistic people are not less, or they are just different. And so that is what we mean by autism. And sometimes we tend to use the word autism spectrum disorder, but I know that many people who have autism don't like the term disorder because they don't want to see it as like something wrong with them. It is just who they have, the way they interact, or the way they engage with the world. But basically, they are just different from those who are not autistic. And it's a spectrum. In other words, everybody who has autism is different from the other person who has autism. No two people with autism, no two children with autism are exactly the same. They are all different. The way they interact with the world, the way they do the things are slightly different, but then there also still some core characteristics that are similar for everybody who has autism. So for us, when we're making diagnosis of autism, we're looking for those core differences, mostly around the social communication, social interaction, and then in terms of what we call repetitive or restricted behavior, the way they do the things may be slightly different. So that is how we know those who are on the spectrum, but they are actually different. So there are some people who have just a little bit quirky. You just know that they are different. There are a lot of people who may be on the autism spectrum who have not even been formally diagnosed because they may be on the one end of the spectrum where people just notice slight differences, but it's not over in your face kind of difference. Or at the same time, you have people who have autism who have very severe disability, maybe who are not talking nonverbal, who have very severe repetitive behavior. And so it is just, it's a huge spectrum. And so we just need to understand that when it comes to autism. Now, how common is autism? Different countries have different statistics. For countries that have statistics, that is, I think in the US, it's about maybe 1 in 36 people. I don't know whether it has dropped further. When I was in medical school, we used to say it's 1 in 140 people have autism. But now, as a consultant pediatrician, it has become 1 in 36. So that shows how um, common autism is. In the United Kingdom, it is 1 in 100 people on the autism spectrum. So they have close to 1 million people, both children and adults, who have autism. That is like 1% of the population people with autism. And so it's a very, very common condition. So it is something that we should all know about. For those of us in Africa, in Nigeria, we don't always have our figures, but we know that this is quite common, and despite the fact that sometimes people tend to hide away children who are on the spectrum, but I think in the last few years, due to the lovely work of many of the charities and organizations, including banks, that took the autism as their CSR thing, I think a lot more people are now aware of autism, and then children that people tend to think there's something wrong with them or they're being spiritually attacked or whatever, people are now beginning to realize that, oh, it is actually autism, and they're beginning to come to us for assessment and diagnosis. So I would say we're seeing a lot more cases of autism even in Nigeria, in Africa, even though I don't have our figures, but I won't be surprised if it is close to figures from the United Kingdom or United States. So generally, autism seems to be on the increase. And one question many people always ask me is that why are we having so many more cases of autism? Is there something in our water? Is there something in the is there, some people are even wrongfully attributed it, maybe it's the vaccine or whatever. But I will still talk about that myths and facts on autism, but it is not. We think generally there is true increase in the number of cases of autism, and we also think there is actually more awareness. So people who will naturally not have been diagnosed now have been diagnosed with autism, maybe because we now have clearer criteria, clearer understanding of how we do autism assessment, and then people are actually willing to be assessed. Some people don't see autism as something they need to hide or something they need to be ashamed of, or they don't have to feel stigmatized. Actually, people now, some people are very, very proud to be known as autistic. We have lots of professionals who have autism, and many of them are on social media, very vocal. People writing books, talking about their experience. We have a lot of parents, and I think that's one of the blessings of social media, internet. A lot of people can come out and share their experience about autism, talk about their children and how they run their lives day to day. And I think that also help other people to see, oh, maybe they can now see what autism look like, and then they can recognize this either in their own family as well, on their own children, and then they also know that, okay, I can get help. And a lot of support groups, online, offline. So I guess generally the response to autism has been positive. So a lot more people are now bold to come out, and a lot more people are coming out for assessment, and they don't see it as something which is a stigma or anything, which it maybe was the instances in maybe couple of decades back, but now it is not. And we have so many professionals who are on the autism spectrum, doctors, nurses, lawyers, and they're quite vocal. Of course, we still have our children and some adults who have severe autism, who have severe disabilities, who need all-round care. But thank God for those who are on the milder end of the spectrum, who are able to advocate for everybody who are on the spectrum. So that, I guess, that is why we simply have more of knowledge and awareness. So that's why it appears to see if it's increasing. I think it's not just a true increase, it's just also more awareness. Now, what are the things? So, like I was saying, autism is a big spectrum, but there are certain core characteristics that we will always see in everybody who have autism. So without these three core features, people cannot be said to have autism. Even though the manifestation may be different from one person to another, from a child to adult, but those core features will always be present in those who have autism. The first is that they have social impairment. People who are on the spectrum struggle with social interaction. So it can vary from those who will not give eye contact, to those who will not respond to their name, to those who will not talk to people, or maybe have maybe one or just two friends, or to those people who actually are over social. People always think of the well, we use the word deficits. Some people don't like it, but people talk about the fact that people cannot do certain things. But actually, sometimes it's the opposite. So which can sometimes be confusing for some parents, because they say, "Oh, my child is very sociable. She actually talks to everybody." So the child will talk to a stranger, the child will go hold the hand of a stranger. So it may look like, oh, that child is very sociable, but abnormal social interaction is also still part of autism. So from somebody who will not interact at all to somebody who over interacts or go and talk to strangers and have no stranger awareness is still a form of social interaction impairment. Another thing is some of them also have communication impairment, and it's not as if they cannot talk. Some may be non-verbal and they are not talking, but you can also have people who are able to talk, but then even the way they talk, some people can be very literal, very black and white, and they may not be able to read the social cues of the social aspects of the communication may be lost. So that's another core features that we see in autism. Sometimes the social and the communication, we kind of lump them together as social communication difficulties. So everyone who has autism diagnosis will have some degree of social communication and social interaction impairment or difficulties or differences. At the same time, another core feature for people who are on the autism spectrum is they have what we call stereotype activities or interests. They have their own way of doing things that are just different. Some people have what we call, they do some things over and over again, they are quite repetitive. Some people are quite rigid. They must follow certain rituals, or they struggle with changes. They want to do the same thing the same way every day. Some also have difficulties with sensory difficulties. Maybe if the noise will be too much for them, or the light is too much, or they will not eat certain food, they will only take certain things. So all those features will always be there. So we need to see these differences, no matter how obvious or not obvious, but those core features must be there before we can say somebody meets the diagnostic criteria for autism. And autism is a developmental condition. It has always been present. So nobody developed autism as an adult. So for diagnosis of autism, those features must have been present in childhood. We may not make the diagnosis of autism in childhood, and a lot of parents are actually getting diagnosed themselves as adults. But we always know that we can always trace back those difficulties to childhood. So if those difficulties were not present in childhood, then we cannot make a diagnosis of autism, though it is possible that the difficulties may not be, or the differences may not be as obvious, uh, in childhood, because the child is able to cope. They're able to, it's really for children who have a lot of strengths and skills. They're able to find their own way of coping with their difficulties or their differences. But sometimes you get to a point where their reserve is overwhelmed, and then that is when we can see some of these features. That is why sometimes we don't get to diagnose children before the age of 5, and some are diagnosed in secondary school, some are diagnosed even as adults. But the differences or the difficulties has always been present, even from childhood. So it's a neurodevelopmental condition. That's another thing we need to remember about autism. Okay, so as a pediatrician, I'm just going to tell us what are those things that you will always see, in children. So this is just another slide summarizing what I've said, So these traits have to be present. They may have the social communication differences, which can be verbal, non-verbal. They can have fixated interests, which they're just interested in certain things. I know children will know everything about dinosaurs, all the different type of dinosaurs. They know them, they recognize them, and yet those children cannot even say mommy or daddy to their own parents. At least you expect them to know, the simple stuff of social interaction. They don't even know the name of their own siblings, but they know everything about dinosaurs. So fixated interest, or some program. I know children who want to watch only Peppa Pig or read only Peppa Pig books. That those are things that we tend to see in children with autism spectrum. You can also see they can have attachment to certain things. They have to go around everywhere with that particular maybe teddy bear or something, or they have to count, things certain number of ways, or they have to line up all the toys. So they will have all those differences as well. They may struggle with maintaining relationships, so they find it difficult to make friends, or even if they make friends, they tend to fall out easily. So then all the repetitive behavior also. So these are the things that are always have to be present. So when we're making diagnosis of autism, we have to make sure we tick the number of boxes, because sometimes some parents think, oh, my child has one thing. There's no one particular trait that once your child has that trait, that child has autism. No. So the fact that your child walk on the tiptoes does not mean the child has autism. The fact that the child is lining up toys does not mean the child has autism. The child needs to tick certain number of boxes in the category. That is what we call the social communication, social interaction difficulties, and certain number of criteria in the B category. Those are the repetitive, restricted behaviors. So if the child has only one part and not the other part, the child is still not going to meet the criteria for a diagnosis. So there's not one particular thing that causes that automatically means a child has autism. And one thing we need to remember, that autism is a spectrum, is always a spectrum, which is why people sometimes struggle, because they see one person, we say this person has autism, but that person is talking, that person has friends, that person is very clever, is even a professor. But you see another person, we say the same, but another child has autism, but this child is non-verbal, is head banging continuously, is still not totally trained, he's still in nappy. So you begin to wonder, how can the two of them have the same diagnosis? So that's where the spectrum of autism comes from. For example, in the terms of the social interaction, so we can have somebody who is just quirky, who will not, who has just a few, group of friends. So people who will not talk to anybody. Maybe it's only one person, their mother or their father, they will talk to. So you can have it as a spectrum. In terms of behavior, you have children or adults who are just hard. You just notice that they're just a little bit different. Just something about them you can put your hands to. But then you also have those who go to can be very aggressive. And the same thing with communication. We have people who don't talk at all, who are non-verbal, even as adults. And then you have people who talk a lot, and they talk like professor, they have very high degree of vocabularies, and you wonder where they get it from. So they can both be on the spectrum. The same thing, with sensory and all that. So you have people who have autism who are highly intelligent and gifted, and you also have people who have autism who have profound intellectual disability. So it's a spectrum. So don't be confused about the fact that is why it's so hard for sometimes parents to understand autism, because every child is different. And I've seen families who have 3, 4 children who are on the spectrum, and each of those children are different, even though they are born to the same parents. Even I've seen twins. Interestingly, I tend to see identical twins have autism, and sometimes you see differences even in them, despite the fact that they are sharing the same genetic materials. So that is autism. And another thing that is also important to know is that most time autism does not occur alone, which is another thing that tends to create that confusion. Most people who have autism rarely have just autism alone. There are so many other medical conditions that can occur along with autism. So, for example, we talk about language impairments, those who are talking, those who are not talking. So, there are people who have autism with language impairments, and there are people who have autism without language impairment. Another common one is intellectual disability or learning disability for those in the UK. There are people who have autism who do not have learning disability or intellectual disability, and there are people who have autism who have learning disability, in fact, very severe or intellectual disability. You could also have other things coexisting with autism. We have people who have autism who have sleep difficulties, people who have ADHD coexisting with autism. It is not all children with autism that have ADHD. Some have ADHD, some don't. You have people with epilepsy also having autism. You have people who have autism who have cerebral palsy. So there are so many neurodevelopmental conditions that can coexist with autism, which is one of the challenge with for those of us who do neurodevelopmental pediatrics. So for us, most of our conditions that we treat, they are usually occurring together. We call them comorbid conditions. They tend to occur together rather than one. So at the end of the day, when we're writing our diagnosis, we are writing 1, 2, 3, 4, 5. Not like in other specialties that it's only one thing. Okay, and that is it. But for children with developmental disabilities, they tend to occur in multiples together at the same time, and it takes professionals to be able to separate and say, okay, this is autism with speech impairment, with language impairment, with learning impairment. It takes the specialists to do this assessment, which is the next thing I'm going to talk about. So how do we know those who have autism? So I've talked about those core features. So most of the time parents start to see those core features early, and some mothers are so good. I've seen mothers who came to me and said from the age of 6 months, I know something is different. So most of the time children have what we call eye contact, they smile to their parents from as early as 6 weeks. They respond to their name from as early as 7 months. So parents have noticed that some of the children with autism, they tend to be a little bit more quiet. They don't cry for anything, and sometimes they don't smile. They don't tend to look at them, their parents. They don't, and there's some parents start to see some of those repetitive behavior, like head banging and spinning and all that. They see them very early, in childhood. But the American Academy of Pediatrics recommend that we should actually screen all children for autism from 16 to 30 months. In other words, we should not be waiting until the children are older and parents actually come to us. We as pediatricians, we should be screening our children for autism. In the UK, for example, they do ASQ for most of the children around the age of 2 years, 2.5 years, and they do what we call ASQ SE, which helps them to pick up children who may have social communication difficulties and refer. In US, they do what we call MCHAT, modified checklist for autism in toddlers, and it is available online. I usually recommend that a lot for most of parents when they start asking questions around autism. So if you think I'm suspecting my child may be on the spectrum because some of the features I've mentioned, you have seen it in your child or you can say it, I recommend just go Google MCHAT MCHAT or go to Autism Speaks website. They have a link for it. So, and there are many other ones, there's CAS, there's so many other screening questionnaires that most of them you can fill them online, and once you fill them, it gives you a feedback immediately. And remember, it is what you fill in, because sometimes some parents, when we ask them to fill questionnaires, they are trying to be nice and try not to, sometimes, especially even teachers, so they don't want to say like something negative. No, just say it is the way it is, because we're trying to decide whether this child needs further assessment or not. So just fill the questionnaire exactly as close to what the child normally does. Of course, most of the time, it's not as if the child would, like who say, does your child always give you eye contact? Of course, it does not mean the child will never give eye contact. But if it is 8 out of 9, the child does not give eye contact, then that should be answered as a yes. If it's like, oh, it's only maybe once or twice the child will not give eye contact, but will give eye contact nine 8 or 9 times out of 10, then you should answer that as a no. So please, all, because some parents say, oh, but I've seen the child does it once, and because of that they will answer it as a yes when it's actually supposed to be a no. So I always separate it's what you put in that you get out, because a lot of parents, now you ask them to go and fill the questionnaires, they've told you so many things, and then they fill the questionnaire and it's coming back as zero, as true, there's no problem. I'm like, that cannot be true, because you just told us this and that and that. But then if you fill the questionnaire and the answer is not coming back as not significant, then that means you have not filled it properly. Which is why sometimes we do what we call follow-up charts, where we, the professionals, we actually give you real examples and we actually help you fill it ourselves, and then we are actually sure you're doing it correctly, and then based on the outcome of that screening we can decide if your child is having a high score 8 and above on the chart. That is high scores for high risk for autism. Remember, it's a screening questionnaire. It does not give your child autism diagnosis. You don't get diagnosed by completing questionnaire online. Okay, diagnosis is by professionals who are trained to do autism assessment, because it's not all the professionals who can do autism assessment. All right, even it's not all the pediatricians, and I'm saying that because especially for those of us in the third world, in developing countries where we don't have so many specialists in that area, because I see a lot of parents, they'll go to their general pediatricians and they'll say this and that, and sometimes people just reassure parents and say, oh, don't worry, it's just a boy, boys talk late. Please don't take those reassurances. I say that with all sense of responsibility. Don't go to people who just listen to you. Don't do any form of assessment, and the next thing they just tell you, don't worry, there's nothing wrong with your child. It will amaze you how many parents have told me, somebody told me there's nothing wrong with my child, but even the parents know. That is why they came to us, because they know something is not right. And I always say, mothers, trust your own intuition. Mothers, we are very good at picking up when things, we may not know what it is, but we just know there's just something not quite right here. So if you as a mother, you are picking up that something doesn't look right, doesn't feel right about your child's development, please come and see the professional. And if you go to see a professional who do not do a proper assessment or don't do nothing, and then they tell you there's nothing wrong, please keep looking until you find the person who will do the right thing. Okay, and these days, thank God for social media, internet, you can always search, and I'm sure you will get, see, you get to the place where you get the right assessment. So autism can be screened for using MCHAR. There are other screening questionnaires. If you have concerns, your child is showing signs, repetitive behavior, and all that, please see a developmental pediatrician. It's not every pediatrician that can do autism assessment. Developmental pediatricians or community pediatricians, as they call them in the UK, or in some countries, pediatric neurologists too, psychologists, psychiatrists, child psychiatrists, speech and language therapists. These are some of the professionals who are trained, skilled in doing autism assessment. Autism assessment, we have what we call diagnostic criteria. We have certain things we're looking out for, and those criteria have to be satisfied in more than two settings. So sometimes parents will tell me this, that, then I'll tell them I need to know what the child is like in school, because if the child is only like that at home with you and not at school, then it is not going to be autism. Autism has to be pervasive. The symptoms must be present in more than two settings. It must be present at home, it must be present in school. If it's for adults, they may have it at home, they may have it at work. So it shouldn't just be only in one setting. That is number one. It has to be pervasive and it has to be persistent. It's not something that happened now and we don't see it again. So it must be going on for like 6 months or more. Okay, and so these are the things that we're looking out for. And then there are two big categories: the social communication, social interaction. The child must tick all the boxes. The child must have differences with their nonverbal communication. They must have differences with their social emotional reciprocity. They must have differences in their relationship beyond those with their caregivers, because that's another thing parents get wrong. They'll say, oh, my child looks at me, he smiles at me, but does the child smile at the other people? So when we're looking at interaction, developing relationship, we are looking at beyond the child's immediate caregiver. If the child is only smiling and playing with you as the mother but not any other person outside the immediate family, that is still a risk, or that is still a criteria for autism. So unfortunately, when it comes to autism assessment, the interaction with parents don't count. We're looking at interaction with people, with the peers at school, with other people in the church, in the playground, not yourself as the mother or the father. Then the B part, the repetitive behavior, there are four of them, but the child needs to only take two out of those ones. There must be stereotypical or repetitive behavior, or motor movements or speech. There must be excessive adherence to routine, or then and then there must be hyper fixation or interest on certain things, and then the sensory hyper or hypo reactivity to sensory input. So those four, but we only need two out of those four for the B part. And then this those are the two A and B criteria have to be met for a child to meet the criteria for autism diagnosis. But there are other things. So it must have been present in early developmental period. We must not have another explanation, because some of those things sometimes it could be the fact that the child is just slow generally across all development. So it's not just the autism behavior. There are other aspects of development. The child is slow. So we must not be able to explain it by global developmental delay or intellectual disability or things like that. Even a child can still have intellectual disability and have autism, but then the autism part must be way above what we expect for that child's developmental or cognitive age. And of course, we also have a way we classify how severe it is and all that. So that is how we make autism diagnosis. So I think for parents, the most important thing is for us to recognize the symptoms and for us to come and see the professionals for assessment. Now, autism is not like malaria. There's no drug. And I know a lot of people are talking about stem cell therapy. As at this day that I'm talking to you, it is not yet a treatment that has evidence. So maybe tomorrow, but not today. So don't waste your money doing stem cell therapy. There are no drugs for autism. We we sometimes use medication to treat certain difficulties. So if a child with autism has sleep difficulties, we can give melatonin for sleep. If a child has ADHD, in addition to autism, we can treat the ADHD with the ADHD medications. So some children have very severe behavior issues and they are causing harm to themselves, self-injurious behavior. Sometimes we use some other medication, but most of the time there are no drugs for autism itself. I know there are a lot of people peddling alternative or complementary, and they say, oh, I give too much of vitamins, chelation therapy. Most of those things, there are no evidence that they work. But what we know works, speech therapy for a child who has speech delay, behavior therapy. So basically, we teach children with autism those social skills. We just teach them. It doesn't come naturally to them, but they can learn it, and that is what behavior therapy does. And we try to teach them in a way we feel for motivates them, using what they like to get them to do what they don't like, and eventually we gradually withdraw those motivation, and some children will have learned the skills in the process. So that is what it does. The bottom, the basis for some of those therapy. They are not magical thing. So the more we do it, the better, and the so it has to be done for hours. So most parents want to do speech therapy or behavior therapy like ABA and the rest of them, and they think once they do it for 1 month or 2 months, everything will be fine. And then when everything is not yet fine, they get upset. So it is. When it comes to therapy, it's a marathon, not a sprint. Okay, it's a marathon. We're going to do it to them for years. When I tell parents about when I'm counseling parents, I tell them it's a long journey, so we have to be patient. And that's why as parents, sometimes we need support group, and shout out to all the support groups for autism on Facebook, online, many of them, Super Parents Foundation, the rest of them doing good job trying to support parents. It's very helpful to know that you are not doing this journey alone. It can be quite stressful. And I just want to also sound a note of caution when it comes to support groups. It's very good when some parents come out and showcase their children who have skills and strengths. Okay, I think one of our children in Nigeria with autism is doing like a painting, the largest canvas or something, and which is quite good, which is something we should all celebrate. But we should be mindful that every child is not going to do that. Okay, which is the challenge sometimes people who we do have in support groups, because some parents see other children who have autism doing all this lovely stuff, and then they wonder why their own child is not doing that. Please remember, it's a spectrum, and yes, some children will have very lovely skills, but some children may not do that. But every child has their own uniqueness. And for some children, if they can just say their parents are happy, if they can just talk, their parents are happy. They don't need them to be a world record holder or Guinness Book record holder. So for us as pediatricians, it's for us to just support every child. But I also want parents to we try to make sure parents are hopeful, because we don't know it all as well. Sometimes, we do say, okay, if a child is not talking by 5, the chances they will talk is low. But these children surprise us all the time. We have seen children who start talking at 7, we have seen people who talk at 10, and then they end up becoming like teachers or authors. So I always say parents always hope for the best, but at the same time, be realistic as well, because the reason why I say that is that sometimes parents are looking for miracles, running from pillar to post, and getting stressed up. And we need our parents. We need you to be well yourself so that you can take care of the child who has autism, because some of the children are going to be dependent on their family, their parents for a long time. And we don't want you as parents to suffer uh, carer burnout or fatigue, so which is why it's better to just celebrate the small milestones and take it one step at a time and get support. Please get all the support you need. Don't do it alone. And don't forget your other children who may not have autism. Sometimes for those of us who have special needs children, we sometimes get so fixated on that one child with special needs, we actually forget the others. And the children themselves, the siblings, they also need support because they feel left out and all that. So please, get support, get professional Let the child be first assessed. Don't make assumptions about your child's developmental diagnosis. I see a lot of parents do that. Just because your child doesn't give eye contact or your child is lining up things, oh, they just conclude the child has autism. Don't do that. That alone does not make your child have autism. So please let that child be diagnosed professionally. There are a lot of people asking me questions on ATP and they say my child has mild autism. There's something like mild autism. There's something like we don't make those kind of diagnoses. Everybody is on the autism spectrum. The kind of support your child may need maybe level 1, level 2, level 3. Level 1 being little or minimal support, and level 3 like all round the cares kind of support. So we talk about level of support, we talk about severity of needs, but we don't talk about mild moderate autism. We don't even talk about high functioning, low functioning autism. We've taken off those terminologies. uh I think I should end up by talking a little bit about myths around autism, because that's a major issue. There are lots of misinformation around autism. So myths and facts of autism. And I think the one I want to really start with is the one on immunization. A lot of mothers asking, and insinuating. I do a lot of autism assessment. I see children with autism every week. So it's something I see all the time. And a lot of mothers kind of insinuate like, oh, it's when I give the MMR that my child start having all these symptoms. And let me just say clearly that MMR does not cause autism. Immunization does not cause autism. Okay. And in fairness, some of those parents tell me because of that, maybe the next child, they did not give the child immunization at all, or they did not give the MMR. And guess what? The child still has autism. So I think that clearly shows that it is not the MMR that is causing the autism. So for those families, it is genetic. Okay, if you are having 2, 3, 4 children with autism in the same family, it is not immunization. We know autism has genetic basis. We know autism runs in families. We know autism affects boys more than girls. We know there are certain genetic conditions that those who have those genetic conditions are more likely to have autism than the people who don't have those conditions. For example, Fragile X in boys is one of the most common causes of intellectual disability. It's also one of the most common causes of autism in boys. We also know Rett syndrome in girls tends to also coexist with autism. So we know there is definitely something genetic about autism. Just that it's not just one gene. So there are about 200 genes that have been associated with autism. So it's still a lot of research, but we also know there's some environmental factor. So I always just tell parents when they ask me what is the cause of this autism, I always say we don't know. Not that we have no clue, but for parents it's easier to just say we don't know why some children have autism, but we know there is some link between genes and nature, between environments and genes. So we know there is nature nurture interaction. There's still a lot of research going on. Hopefully, very soon we have the answers, but currently we don't know. So, which is why there's also no treatment or cure for autism, because when you don't know the cause of something, how are you going to treat it? So again, that's another factor. But one thing we can all agree on is that autism is not caused by immunization. Another thing I would like to talk about is the fact that it is not only children that have autism. Yes, autism starts in childhood, but adults have autism. Children who have autism are going to be adults with autism. People don't lose autism diagnosis. They may be different. They may have overcome their difficulties. You have professors who have autism. You have people that if they don't tell you they have autism, you will not know they have autism, but they still have the autism, even though some of their difficulties may not be as apparent. Okay. Then there is these beliefs that people who have autism must have these special skills, what we call savant skill, so they must be able to draw very well, even just saying for 1 second that they must be able to play the keyboard, a prodigy and all that. It's only few people with autism that actually have those kind of skills, which is why I'm actually sounding a lot of warning in our bid to celebrate our children who have some of these special skills. Please, let's not overemphasize it and cause other parents who do not have children who have those kind of skills to go into depression and wonder why their own children are different, because which is the challenge we do have. So I always want to emphasize the fact that all children are unique, all children are different, and all of us don't have to be the same thing. We don't have, as long as we're all happy, well integrated members of the community, of our society, that is all. We don't all have to be a prodigy, and all that. So majority of people with autism don't have those special skills. 50% of children with autism have intellectual disability, which means that they are very dependent all their lives. So they are not going to be doing anything that will make them to get Guinness Book of Record, but they are still very important member of the society, and they are happy people with the family around them, and that is the most important thing. Then some people think all people with autism have low intelligence. Of course, that is not true. We have very, very extremely intelligent people with autism, but we also have people with autism that have intellectual disability. That people think, oh, people with autism are not affectionate. Again, which need to move away from generalization. There are people who have autism and they are quite affectionate. There are people who have autism who are married, who have children. So it doesn't mean, it's just that people with autism, some people don't like to be touched, so they want to be the one to, so they like for you to tell them before you touch them or things like that, but they are happy to give hugs if they want to. Some people don't like it because it's a sensory thing for them, so, but it's not everybody. And there are people who have autism who actually are very cuddly, and they're always giving cuddles and hugs to everybody, including strangers. So again, autism is a disease. That's another myth. Autism is not a disease. Autism is just a difference. It is not something people will catch. You don't have autism by living with somebody who have autism, or drinking from the cup, or eating together with them. So we should not discriminate against people with autism. It is not a disease. I think most of us are aware of that already. All right, my time is up. Look at this one, something different that I was going to show. Um, I just want to say it is World Autism week, World Autism Day on the 2nd yesterday. We should all know about autism. There is no excuse for ignorance, and this is one of the reasons why we are having this webinar. If you want to read more about autism, you can go on our website. We've written a lot about autism. We've done a lot of talks about autism. I think last year I did a lot of Q&A, question and answers on autism. You can listen to them on our podcast, and there are lots of lovely resources online. We should all be aware of autism. We should make sure that our children are getting assessed, properly assessed and diagnosed, and make sure that we're giving them the right support. And lastly, I want to call on our governments to make sure that we, especially for those of us in the third world countries, in developing countries, we need more resources. We, most of us, we don't even have speech therapists. We don't have professionals. All our doctors are living in droves. So who's doing this assessment for our children? So we need the government to make sure there are resources. Their therapies are so expensive when people pay for them privately. So we need government to make the resources available, subsidized. And lastly, for the private sector, thank you so much. You've created a lot of awareness, and a lot of families are now aware of autism, but they need their children diagnosed, they need their children supported. So I think let's do less of the jamborees of the talking about autism, spending millions, bringing people in to talk to our people about autism. I think we all know more about autism. I think what people need is that support. People need support with the diagnosis. People need support with therapies. I think we should spend our millions, our CSR millions, to do that. I stand by that statement. It's something I've advocated for years, which is why sometimes I don't accept the invitation to just come and speak and then collect all this honorarium. Please spend that money to provide assessment, free assessment. Spend that money to provide the support for the children. I think the family will be blessed, will be happier that way. And let's have therapy centers supported by this our CSR, something that is sustainable, not just a once in a year jamboree and noise all over the place, which is more of promoting ourselves rather than supporting the families and the children who need it. I think everybody knows a lot now about autism. We have it all over the social media. I think what people need is, where can I go for the assessment? Where can I go for the therapies? People are paying millions out of pocket for therapies. That is what I felt we should be supporting and we should be subsidizing. And for us on NCP, we will continue to provide support as well in our own little way. So thank you so much everyone for listening to me. My time is up, but it's a favorite topic, so I can talk all day on autism and not be tired. But if you have any questions, please feel free to go to Ask the Pediatrician Facebook group and post your questions there. Thank you so much. And light it up blue for autism. Have a wonderful, wonderful rest of your day. It is bye from me.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.